You arrive at a home and find an elderly patient who is receiving oxygen through a nasal cannula. The patient is 65 years old and appears overweight. She's sitting in a chair in a tripod position. You see rapid respirations, and there's cyanosis around the lips, fingers, and capillary beds.
Okay, my PPE is on. The scene is safe. It appears I only have one patient. Considering ALS at this point, but I don't think it's necessary right now. My nature of illness is just difficulty breathing as it appears right now. It doesn't seem like I need to take spinal precautions, but I'll ask the patient. Hello, my name's Aaron. I'm an EMT. What's your name?
Allison?
Allison, did you happen to fall and hurt your head, neck, or spine today?
No.
Okay. So I don't think that I'll take those spinal precautions. Chief complaint is difficulty breathing, but it appears like it's difficulty breathing, but I'll just ask, what's going on today?
I'm struggling to breathe deeply, and I can't really talk without coughing.
Okay. So yeah, like I said, patient's chief complaint is difficulty breathing. At this time, my general impression is poor. My patient is A on the APU scale, awake and alert, because they're talking to me. All right, and then kind of like I said, because the patient's talking to me, I know that I have a patent in open airway. I'm assessing the patient's breathing, and I'll actually, it looks normal, like I've got bilateral chest rise, but I'll assess the patient's respiratory rate.
You get 28.
28. Okay, based upon the increased respiratory rate and the cyanosis around the lips and the fingers, I'm going to put this patient on a non-rebreather at 15 liters per minute. I assess how the patient takes the oxygen. Does that make it any better?
A little bit.
Okay.
Yeah.
If I had a pulse oximeter, I would put that on the patient to ensure a good oxygen saturation level. Do you have a saturation level?
I see one right now.
Okay. So yeah, like I said, I have a patent airway. Respiration rate we took a look at, and then we also applied non-rebreather at 15 liters per minute. Does the patient have any major bleeding?
No.
Okay. I will take the patient's pulse at this time.
120 and strong.
And then I'm assessing the patient's skin condition.
There's cyanosis around the lips, fingers, and capillary beds.
Okay. Does it appear the cyanosis is getting better with the non-rebreather?
No, not really. Not yet.
Okay. So at this time, I would consider this a priority patient, immediate transport. So with the oxygen on, we would be in the back of the ambulance at this time and move on to the history taking. Signs and symptoms, anything else going on other than the difficulty breathing?
No, just kind of coughing, and that's about it.
Okay. Are you allergic to anything?
Penicillin and bee stings.
Do you take any medications?
Just oxygen, and then I have a inhaler also.
Like a meter dose inhaler?
Mm-hmm.
Have you taken the inhaler at all today?
No.
Okay. And then do you have any relevant past medical history?
I've been treated for emphysema for the past 10 years.
Okay. And then what was the last thing you ate and drank?
I ate breakfast this morning.
Okay. Anything to drink?
Just coffee with breakfast.
Okay. And then what were you doing right up to the point that you called us?
I've just not been feeling good. It started a couple days ago, and then today it just got really cold, and I've just felt really bad since I've gotten out of bed.
Okay. And then when, you kind of already mentioned this, but when about did this start to feel bad for you?
Well, I've had emphysema for the past 10 years, but my breathing's gotten worse just the past couple of days. And then this morning was the worst.
Okay. Does anything make the breathing worse?
Whenever I go up and down the stairs, it gets really bad.
Okay. And then can you describe the quality of the pain?
I don't have any pain. I'm just worried because it's so hard to breathe. I can't seem to catch my breath.
Okay. You don't have any radiating pain anywhere?
No.
Okay. And then no pain, but in terms of just the difficulty breathing, on a scale of 1 to 10, 1 being easy breathing, 10 being difficult breathing, how would you rate this?
I can't stop coughing, so probably a 10.
Okay. And then has this kind of come and gone, or has it stayed pretty constant since you called us?
I woke up about 3 hours ago, and I haven't been able to breathe right since.
Okay. And then in terms of the severity, you said it was a 10 out of 10 for the breathing. Has that been a 10 out of 10 the whole time?
Since I woke up, yeah.
Okay. And then I know you said you don't have any, or let's see, the quality, hold on. You said 3 hours ago is when it came on, and it came on constantly, or was it kind of gradual? Or sorry, did it come on gradually, or all at once?
Just whenever I woke up is whenever I kind of first noticed it.
Okay. All right, that is my history taking. Now we can do a focus assessment. I will look, listen, and feel at the patient's chief complaint, which is the difficulty breathing. So I'll auscultate the lung fields, and do I hear anything abnormal? Okay. I'll also look at the patient's chest. Do I see anything abnormal? And also feel the patient's chest. Do I feel anything abnormal? Okay. Okay, so now we can do more vitals. So I've already grabbed the patient's pulse and the respiration rate, but I would do a blood pressure at this time. What is the blood pressure?
140/88.
And then the pulse and the respiration rate, is it the same?
Mm-hmm.
Okay. My field impression of this patient is poor. Once again, it's kind of, we're already in the ambulance, but just gonna keep transporting to the hospital to get the breathing looked at. Interventions, we've already applied oxygen at 15 liters per minute with a non-rebreather, but I would call medical control en route to the hospital and check if there's anything else that we can provide this patient for interventions. I would reassess the vitals every 5 minutes en route to the hospital. Do I notice any differences?
No.
Okay. And then as far as my handoff goes, once we make it to the hospital, the next level of care is I have a 65-year-old female patient who is complaining of difficulty breathing, blood pressure 140/88 with a respiration of 28 breaths per minute, pulse is 120 beats per minute, strong. And we have applied oxygen to this patient with a non-rebreather at 15 liters per minute. The patient seems to be doing okay, but is not improving. Vitals not improving. That's it.